Hey guys, this is Dr. Ashley here from Head to Toe, and today I was going to talk about shoulder pain, and shoulder pain specifically as it relates to biceps tendonitis. So biceps tendonitis is an injury that we have seen pretty frequently at the clinic. It can be seen in many different ages of people, general population, even athletes to be specific. And it mostly comes from overuse activities, overuse meaning something that you do every single day. It can also be a traumatic type of injury, meaning that there was one specific event that could have caused that shoulder pain. And more often than not, it's going to present itself right at the front of the shoulder here. Sometimes it can radiate down the arm, sometimes it can radiate to the back of the shoulder. So to give you a little bit of anatomy, I've got the skeleton here. So when we talk about biceps tendonitis, we're obviously talking about the tendon of the biceps muscle. The bicep muscle sits on the humerus, the upper arm bone, and there are two tendons of the biceps muscle that actually allow it to attach to the shoulder. So the longer tendon of the two is the one that's actually inflamed and injured when you get biceps tendonitis. The biceps is also often referred to as the honorary rotator cuff tendon just because it sits on the shoulder, and the rotator cuff muscle is also attached to the shoulder in and around the same area. So that's why when I mentioned earlier, you might get pain at the front of the shoulder, you often might get pain at the back of the shoulder. And oftentimes you will get biceps tendonitis if the rotator cuff is tight, if you don't know how to use it properly, and if you're putting too much pressure on those muscles, it's actually going to cause the biceps to take up a lot of that load. So when you come to see us at Head to Toe, we like to take a multi-step approach to fixing your pain, getting you out of pain, and actually treating your injury. Our treatment is very specific to you. We like to do 3 different things to kind of help out with that. The first of them being chiropractic manipulation. So obviously there are a lot of joints in and around the shoulder. The spine being one of them, the upper back, the neck being one of them. So if you have any specific shoulder issue, we're definitely going to look at other areas in and around that shoulder just to see if it'll help to loosen up some of those muscles, just to see if it'll help to give you a little bit more range of motion in that shoulder. So you can expect adjustments in those areas. And I'd say if you've gone to a chiropractor and they haven't really looked at those other areas besides your shoulder, you're probably in the wrong place. You want to find somebody that's going to give you a wholesome approach, looking in and around all areas of that upper body. Secondly, what we're going to do is we're going to fix the soft tissues in and around that area as well. So we have a lot of manual therapy techniques that we use. Given that biceps tendonitis is inflammation of that tendon, we're probably going to want to do some laser treatment on there too, just to make sure that we can get that structure to heal properly. So besides getting more range of motion to that joint with the adjustment, the soft tissue work is also going to help with that. We're going to make sure that all the muscles in and around that area are working the way that they should be and are pulling the joints into those range of motions as they should be as well. Lastly, we're going to do a lot of rehab on this area too. That's kind of the icing on the cake with what we do here. It goes hand in hand with our soft tissue work, it goes hand in hand with our chiropractic adjustments, and it really just brings everything together. It doesn't really make sense for us to do the adjustments and do the soft tissue work if we're not going to teach you how to move properly. Obviously, you spend more time outside of the clinic than you do in here, so we want to make sure that you have the right tools necessary to make sure that you're not putting your shoulder or any of those other areas that I mentioned, at risk for causing you more injury. So if you enjoyed this video and you want to see more things like it, go ahead and give it a like, comment down below, and we shall see you on the next one. Make sure to follow our Facebook page, Head to Toe Spine and Sports Therapy. We're also on Instagram at Head to Toe Clinic. So if you have been experiencing any type of biceps tendonitis pain, even shoulder pain in general, and you're looking for a different approach to hopefully get yourself out of that pain, go ahead and give us a call and we'd be happy to set up an appointment for you and to develop a treatment plan very specific to your injury.